And it's not a curriculum for social justice. It's social justice runs through the veins of the entire curriculum. We even have a wall, which we call our social justice wall. And for all of those that think this is some woke statement, it's actually Catholic. And so blame Jesus, you know. And the poster I like the most that somebody put up on our social justice wall is one word. It says nah. And underneath it says Rosa Parks, 1955.
I love that. Hello, everyone. It's Dr. Erkeda here, and I have a really special guest, Dr. Pedro Jose Greer. And I'm just going to give you an opportunity to tell our listeners a little bit about yourself and your journey to medicine.
Oh, okay, that's interesting. Hi, I'm Pedro Jose Greer. They call me Joe, so you can call me Joe also. Mm-hmm. I'm by formal training a hepatologist, gastroenterologist, and internist. But by passion, my passion has always been to take care of the most vulnerable of our society. I actually started off my career, 40 years ago, or a little bit longer, as an intern at Jackson Memorial Hospital in Miami, Florida, opening clinics for the homeless and undocumented, and then for the migrant workers. As I continued on through my training, I always found that one of the most important things that led me in my life was social justice. And I felt that as physicians, we had a very strong social accountability. Actually, in college, I was not pre-med. My father was a physician, and as anybody that grew up in the 60s and 70s, you wanted to do anything but what your father did. So I wanted to save the world. That quite didn't work out. Then it was a very turbulent time. People forget the mayhem of the 1970s as we lived through the mayhem of the 2020s. And it was a very divided country, a very violent time. Kent State in 1970 with the murder of those students. And that continued on in Jackson State. And people forget that one. That was 10 days later in the protest. And the protest was because African Americans were realizing that, hey, they're sending more of us to Vietnam than the rest of society. And there was multiple reasons for that. You could get a deferment for education, but not a lot of African Americans could afford education. And then you had to be in the top half of your class. You deferred from the draft. So at that time, and then the president resigned, all these things happened, the Pentagon Papers. It was, what's wrong with our society? Why are we not better? We're a democracy. We're supposed to be opportunities for everybody. And the direction I was going was actually law school, and I was so disillusioned by Nixon and what was going on that I said, what else can I do in my life that can improve my society and my country or the world? And I became somewhat disappointed in my country, I'll be honest with you, back then. But understanding how democracy works and it's a pendulum, let's make it better. This is a country that has given me my opportunities. And so I decided on medical school. Why? Well, I could work and live anywhere in the world as my parents were immigrants. I was born here by accident. My daughter would say that I'm America's first anchor baby. My mother was visiting and I was born here. And that's what got us out of Cuba because the U.S. wouldn't give us a visa because my father was the first one to finish high school. And I could live anywhere in the world. I could do clinical. I could do research. I could do social. And through medical school, and what I saw was this extreme poverty. And then 1980s hit, early 80s, AIDS, crack, Reagan, recession. And I was seeing that in my own backyard. So we started clinics for the homeless. And by doing that, one of the things I realized was I was doing nothing more than patching up wounds. The fact that they were homeless was why they were sick. And as I continued in my career and subspecialized, et cetera, and the reason I went into hepatology is, as a Cuban American, we Cubans had twice the incidence of liver cancer as the rest of Americans. Turned out to be hepatitis C. And once again, a disease caused by social determinants. In other words, those that had hepatitis C when they came to this country or cirrhosis were mostly upper middle class and wealthy families. Why? Because in Cuba, the upper middle class and wealthy had their own syringes for vaccines and B12 shots. And they would boil the needles for 10 minutes, which would kill everything but the non-A, non-B, which eventually was labeled C and other viruses. And so I started very much getting into this whole aspect of the social determinants. In other words, how do we make health equity in this country? Well, it's not through health policy. It's through social and public policy. It's by allowing people the opportunities that this country is supposed to offer. And as I continued in my career and did very well financially, I got to a point about 20 years ago when I looked at my wife. I said, I never thought I'd make this much money, and I've never been as unhappy as I've been. I said, our profession has become one of money. Now, don't get me wrong. I enjoy money. And obviously so do my kids, but my money anyways. The idea is, what can we do to improve the life of others? And I ended up working in two presidential administrations, Bush Sr. and Clinton. And I was able to advise. I've been with the RAND Corporation as a trustee for about 30 years. So I was very much into policy and policy analysis. Why are we not addressing the policies that make us sick, not the policies on how to deal with illness? And it can be preventable, and we can give people opportunities and go on. Well, one of the things I started seeing, well, I'm not going to change the industry. Maybe I can go back into academia, which I had started in my career and before going into private practice with my father. And we started a new medical school at Florida International University in Miami. And we had the very first new curriculum in over 100 years. We became the first medical school in the country in 2009 when we opened to actually teach social determinants of health, and we presented that at the Institute of Medicines. And the idea was, why are we not teaching the causes of disease? Why are we not, as leaders in a community, because we are physicians, taking that banner and saying, we need appropriate housing. We need living wages. We need non-toxic environments for people to live in. We got to quit throwing away talent. And the more I was involved in medical education, the more I saw that, what kind of hubris do we have as academic physicians to say we want health equity when we don't have equity in our profession? Let's just call it out as it is. We're racist, we're sexist, we're xenophobic, we're elitist. And if that's not enough, we lack the proper virtues of humility, of empathy, of compassion. And without virtues like that, you don't have the core of what we need to make the effective change to get to true health equity. It's really not a difficult formula. Give people an environment where they can flourish, and they will. Plant a flower in a rich soil, and they'll do well. Put that same flower in a toxic soil, and it won't. Same flowers, same genetic makeup. And we decided at our last institution we were going to be truly diverse. So we actually became the second most diverse medical school in the country, with over 55% of our students being underrepresented minorities, African Americans and Hispanics. And I believe as a medical educator that diversity represents the community you live in. Here's the interesting thing. Back then, 70% of our students only got into our institution. We were brand new. 30% were first generation. Every graduating class we had from 2012 to 2020 had the highest step 1 and step 2 pass rates and scores, and the highest match. And I used to love this comment from folks when they'd say, well, you have African American and Hispanics, and, I thought we wanted primary care physicians. They're going into ophthalmology. I'm sitting there going, wait a second. They, like everybody else, have the right to choose what subspecialty they want to go into, number one. And number two, and do you really think that in our communities, Hispanic and African Americans, with the incidence of diabetes off the wall, you don't need an ophthalmologist? Did I miss something here? Number one cause of blindness? Mm-hmm. So the idea is, say it as it is. Say our admissions criteria are not correct. Our pre-med requirements are not correct. I'd rather have a liberal arts major as a medical student because, for goodness sakes, they're great critical thinkers and creative thinkers. Not only that, listen, I'm going to teach you science. And you do need science to get into medical school. However, you need humanity. You need the aspect of understanding other people, of respecting other cultures, of having cultural humility, to accept others. But first of all, as a physician, we need to understand their histories. How do you understand the pain somebody is going through unless you understand their history? And you go through this the whole the entire way as you go and you look at these different things. For example, in our private practice, I would go out in the waiting room and get my own patients. Why? It's a simple courtesy, for goodness sakes. You know, what is the regular routine we do? Come, knock on the window, nobody answers. We'll hand you a piece of paper, an iPad, fill it out, sit down for 2 hours. We'll put you in a gown that's like an HMO. It doesn't really fit, cover everything. And then we'll stick you in a room by yourself looking at posters of disease. Then we'll walk in. I've never been to a business meeting in my life where somebody does that. If I'm visiting the vice president or president of a company, they actually come out and greet me. Why can't I do that? And by the way, when I introduce myself to a patient in my office, I introduce myself as Joe Greer or Pedro Greer. Why? Because I'm not giving them a title. And I want to get rid of that power differential. What's my ulterior motive? My goodness, they feel comfortable and they're going to give me a good history. Every one of my patients has my cell phone number. Does anybody abuse it? A few very wealthy people, but, you know, that's the way life is. And going into medicine gave me the opportunity of saying, I'm here to advocate for you. I don't represent you. You didn't elect me. But let me advocate for you. Not only that, I'll see anybody during the Great Recession that we had in 2008. In my private practice, we actually send out a letter to our patients saying, if you lose your insurance, you're still a patient here. Why? You can't abandon somebody. And it's not like during the recession, doctors weren't being paid when everybody else was losing their jobs. And, you know, as much of a business as we are, we're not a business. We're here to serve. We're professionals. Yeah, you have to have a bottom line. You have to have the sense of what you're doing, but greed is not acceptable, and particularly when it comes to people's lives. How is it that when we get into medical school, we do it by writing a letter saying, my intentions are to take care of everybody? We do a white coat ceremony from the Gold Foundation, of which I'm a board member there, which is, you know, about humanity, humanism. We go on the wards in a public hospital where the unfunded indigent patient is there. We take an oath when we graduate. And then when we graduate, we say, we're not going to take you because you're uninsured. For goodness sake, these are the individuals that taught us how to be doctors. And now we're going to throw them by the wayside? So now that I'm old and my runway has gotten much, much shorter, I feel, you know what? I'm just going to tell the truth. At least as I see it. The truth might be different for somebody else. But these are the experiences that I've had from working under the bridges with the homeless to working in the old executive office building up in D.C. We have to be the voice for those that we advocate for, which means we need to talk to them before we have that voice to see what it is that they really need. Mm-hmm. Medical school has to change its admission criteria. It's number one, too quantitative. We miss out on all the qualitative aspects. We have to get back to making sure that we teach the virtues and show it by example. And as an educator, I got to tell you something else. We got to get rid of this toxic medical academia environment. It's not about your title. It's not about your position. It's about educating the future workforce. Anyways, besides that, life is good. I've been married 43 years. I got 2 kids. My daughter, actually, I'm so proud of. She runs an organization called Community Justice Project. And she went to Harvard Law School. And so she could have done anything she wanted, graduating top of her class. But she's there advocating for community law. Actually, Echoing Green has sent her out to South Africa and to South America to teach community lawyering. And it was interesting because when she got into law school, and I said, I know you're smart. I married up. I know you like to help people. Why don't you want to be a physician? And she looked at me and she said, Dad, you don't get it. Physicians are doctors to people. Lawyers should be doctors for society. But we as physicians have to jump up and say, let me join you in that journey. We have to be doctors for society too.
I couldn't agree more. And I feel like you said so much that I want to kind of unpack. So we may have to invite you back for another episode. But like I can definitely identify, like I was first generation in medical school. I did it through a program called the Early Medical School Selection Program affiliated with BU. And it's where the majority of Black and Latino students got in. But there was always kind of like that focal view on the student body from there. And just students who are given the opportunity to thrive will thrive where they are. And it's more than just numbers and all of those kinds of things.
And we as educators have to have the support systems for those students. A first-generation college student or first-generation graduate student does not know what's going on and obviously can't call home and ask. So we have to be there to support them.
Yes, I could not agree more. And if you build these systems and if you are kind of advertising your institution to supporting these populations and these students and getting people out into the world, you have to have a place where they can go because their experience is going to be different. So you cannot just say, okay, you made it into the school, go figure it out. Where, of course, yes, you will integrate and kind of talk with other people in the community and make friends and things like that. But it is a unique experience. Other things that you talked about, when I first started worked at a FQHC. For the listeners out there, that's a federally qualified health center, community health center. And mine in particular, 50% of the patients were uninsured or undocumented or LGBT and needing different medications or HIV care. And one thing that I noticed with a lot of the patients is, and I guess just the systems is, it shouldn't matter what you fill out on the forms. Like you should be able to get the same care that somebody with Blue Cross Blue Shield gets because we're all human beings. These are the things that we do.
Or better.
Or better, because there are a lot of things, like you said, just in the systems that just have made things kind of progress worse and you're coming in at different states. So we love to say that medicine isn't political and we're not supposed, but it is. It is.
Are you kidding me?
The hot phrases of like the social determinants of health.
What did Verschow once say? Politics was nothing more than medicine on a much grander scale.
Like, I love that. Because it is, and everything, like we're in a hot phase where they're using the words of social determinants of health, and it helps people kind of understand how things intersect, but it's basically common sense. Like, of course you're going to do better if you have food on the table, a good place to sleep, not a lot of harm and violence in your area and things like that, money in the bank. Of course you're going to be healthier. So how do we advocate to get more people like that? And how do we teach our students, the next generation, how to do better than our predecessors?
Well, it's interesting. This is exacerbated, having come from South Florida, after a hurricane. If you're in a lower socioeconomic area and you have, say, food stamps or something else, which is all now done by credit card, and a hurricane hits, that card is useless. There's no internet. There's no electricity. People survive after a hurricane or disaster if they have cash. They have no cash. They have no money to repair their homes. They have no job because nobody's working right now. So we look at life through the lens of our own experiences, as opposed to, once again, those that have a good liberal arts background and understand the history of the world and the history of a culture and the history of a people. Understand, hey, things aren't very equal. Let's make it as equal as we can. Let's treat every individual with the utmost respect. Let's get back to what they taught us when we were kids, that I'm going to treat you the way I want to be treated. I'm no better than you are. As a matter of fact, I remember when we started off working with the homeless, all I could think of is, I couldn't survive here. What makes these individuals so special that they can? And listen, there's too many injustices. And what we need to do is advocate and defend those that are left behind. It's very simple. We've been blessed by being able to become professionals. We're in a position where we can make change. And when I'm in DC, I'm not advocating for higher reimbursement for my specialty. Really? So I can get a German car every year? Or do I advocate for the fact that African Americans and Hispanic, highly uninsured at the age of 40, have increasingly high rates of colorectal cancer, but yet they can't get a colonoscopy because they have no insurance? And we have the science. Let's apply it equitably. Let's apply it in a way that makes our country the healthiest country in the world. We rank so poorly in health outcomes and spend so much money that internationally it's an embarrassment. Look at our maternal mortality rate, which is off the wall. And if you're African American, it's 9 times higher. And if you're Native American, it's 19 times higher. If you live in Bangladesh, you live longer than if you live in Mississippi. And the same thing with Haiti and Native Americans. What's wrong with this picture? We're one of the wealthiest nations in the history of the world. It's up to us to make the appropriate decisions to make sure that the survival of our entire society. A healthy worker maintains your business going longer. A healthy worker allows them to support their family. By us going into the community and looking for first-generation students, why? Because they're just as brilliant and probably more so than our kids that get to go to Ivy League schools. And you sit there and you say, let me give you the opportunities. If I can get you into med school or a health profession, guess what? You'll be the first one in your family to earn generational wealth. Why is that important? Because everybody goes to college. My father's the first one to finish high school in his family, and his granddaughter graduates from an Ivy League law school. And she's doing the right thing. And so it's how you bring people up. We never brought up our children to believe money was the most important thing, just the opposite. That's why my son is a professional comedian and my daughter is in public interest law. Because what it was how do we make society better? My son sees it as comedy is the last bastion of political incorrectness where you can make a great social statement. My daughter goes out and saves the lives of people. And I get to be the proud father of both of them.
That's awesome. And you have definitely influenced medical education, as you mentioned, in terms of the school that you were with in Florida and how you were one of the first.
And the new one was starting here.
Yes, you were one of the first to have a curriculum for social justice and improving health equity. And now
it's not a curriculum for social justice. It's social justice runs through the veins of the entire curriculum. We even have a wall, which we call our social justice wall. And for all of those that think this is some woke statement, it's actually Catholic. And so blame Jesus, And the poster I like the most that somebody put up on our social justice wall is one word. It says nah. And underneath it says Rosa Parks, 1955.
I love that. I have a shirt actually that says that, a t-shirt.
Yeah.
Yeah.
That's one of our posters.
That's hilarious. So how do you incorporate social justice in the education at Roseman University?
Well, one of the things you do is you show it by what you do. For example, we're hoping our first class in the next few years, and we get accredited, that you come in here knowing that that's what we're about. So you have programs already set up. We already have 3 programs. One is called Aspire, where we're in the east side of Las Vegas, which is mostly Hispanic, and the historic west side, which is African American, recruiting kids that are first generation and their parents through day-long sessions where they learn science, the arts, everything, and we can talk one-on-one with the parent and say why it's important for them to go to become a health science professional. They can become at our university a dentist, a doctor, a pharmacist, or a nurse, or a graduate nurse. We have another program called Genesis. Genesis is household-centered care. We have electric cars that have been wrapped by local artists. We hire people from the community. We develop interdisciplinary teams, and we take care of a household for the duration of their needs. That means a medical school student will be responsible for these households, of which they have to make household visits. So this student that comes from a family from Beverly Hills is now going into somebody's house. They're not coming to the ivory tower. So that changes the differential, the power differential. And they learn empathy and they learn humility. And we've been able to prove that because you can measure empathy and humility, and we'll be doing that again. The last program we have is called Empowered. And Empowered is a program for opioid and stimulant use disorder pregnant women and recent mothers. Why? Because we have to be socially accountable. That's a major problem in our community. And here we're dealing not just with an addiction or a use disorder, but we're also dealing with maintaining a mother and child together against the existing laws that are there. And giving them the hope not just to that mother, but to their children and the future generations. And we don't judge. If there's recidivism, we don't get mad at them. We say, let's work with this, because we know that that's the reality of use disorders. And by the way, for anybody that says anything, there's nobody that wants to be an addict. Nobody. Some people have the genetic makeup where that's going to happen. And as such, let's treat it like a disease. Do we judge people with hypertension? Do we judge people with glaucoma? Who are we to judge anyways? The only thing that we're allowed to judge on is a diagnosis, because that's what we're trained to do. Do we have to like everybody? Nah. We have to respect everybody. And we have to accept people as they are.
I couldn't agree more, and I love all of the different initiatives that you guys have going on. And your final statement kind of reminded me of when I was on my family medicine rotation in medical school, and we were helping people who were unhoused with substance abuse issues. And my preceptor at the time, and this is kind of when it solidified that I wanted to go into family medicine, he said something very similar to what you said. He said, in kindergarten on career day, when you're asking the kids, like, what do they want to be? People will say a doctor, a lawyer, astronaut, all of those things. Nobody says, I want to be a diabetic. I want to do this. I want to be a drug addict.
That's right.
No one says that, but life happens. So the same way you would treat someone who's living with diabetes should be the same way you should treat someone with substance use disorder.
Listen, I'm a 60, 70 kid. Believe me, I have enough of my peers, dear friends, that unfortunately got very involved with drugs. Mm-hmm. And I've seen the consequences throughout the years, whether it's incarceration or death. And so we do what we do because it's supposed to be the right thing to do. And our profession has to get back to, it's not about me. It's about that I'm part of a profession that can improve the lives of so many. And the argument that I hear even in academia is, stay in your own lane. Well, okay, let me see. If somebody shoots somebody and they come to the ER, isn't that our lane? Just a thought. If you have a toxic environment where people live and it makes them sick, isn't that our lane? If you pass a law that says you don't have to wear a seatbelt and you go 100 miles an hour and people come in injured, isn't that our lane? Or do we just deal with them once they become injured? Or do we say something like, why are we doing this? And for all of you that want to look at this from an economic focus, I have no problem with that either. The guy that gets, or the woman that gets in the car accident and it's left with severe brain damage, what's that going to cost society? What's that going to cost the family? Not just emotionally, but financially. So there's counter arguments to all this. And there is no policy that is set at a local, state, or national level that doesn't have health implications. Getting rid of a library system, poor transportation, lack of people feeling safe, things of that nature. So let's all fight for what we're supposed to do, the right thing. This is not a partisan issue. This is a human issue. And in many ways, an American issue. We're supposed to be the country of opportunities. Let's make sure we give everybody those.
Absolutely. And you've shared so many words of wisdom. And for my final question,
yes,
to kind of think back to when you were starting medical school in the beginning of your career, I think a lot of us had different ideas of where the path would lead us. And as you mentioned earlier, sometimes you can have all the accolades and you can think you're going in one direction, and then you're like, I don't really love it here. I want joy. I want to do what's supposed to be here for. So what is a piece of advice that you wish you'd known when you were entering medical school that you would like to share with the students?
What I will tell you is why you want to go to medical school. Write it down on a piece of paper. Stick that piece of paper in a drawer, or nowadays put it in your phone. Who cares? And you know what? Every day you have doubts, look back to why you came into this profession. Why are you here? If you're here purely for money, well, I don't feel so bad you're going to be so damn unhappy because we don't have the greatest hours in the world. And if you really want to be rich, think about it. 4 years of college, 4 years of med school, 3 to 7 years of training, $250,000 to $400,000 in debt, and then you start working. Go to college, get your MBA, you're out in 6 years. You beat it by 11 years, you got a chance to make a lot of money. But if you're using our profession for that, be smart. Do something else.
I love that. Like, just know your why and think about it often. So I really appreciate all of the words of wisdom that you've shared with our listeners. I just want to give you an opportunity to say goodbye.
Well, all I can say is, if we follow your lead, our world will be better. Do things for the right reason. Remember what our profession is about, and our profession is about service, about serving others. We're not here to save lives. We're here to improve lives. Sometimes we're lucky enough when we can save a life. But you know what? When you can't, sit at the bedside. Talk to that patient. Talk to the family. Be open. And most importantly, always be honest.
Thank you so much. And for all of the listeners out there, be sure to share this episode with your friends. We're on YouTube now, so you can go and check out that. And then if you have any recommendations for any future topics or guests that you'd like to have, just reach out to me on my Instagram at Dr. D Graham, DOCTOR, the letter DGRAM, and we'll get back to you. Have a good day. Bye.
Thank you so much for having me.
Thank you.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.